On this week's Cardiology Countdown, we'll start with a fascinating study from the PREVENT-4 study looking at graft failure from coronary bypass surgery. This was a study looking at a special graft, but this was an analysis looking at angiograms done about 1 to 1.5 years post-CABG, and then the subsequent rate of cardiovascular events. So in this way, they were able to assess in about 1,800 patients graft failure angiographically, and then the clinical consequences thereafter. And very interestingly, they found about a 50% higher risk of revascularization, but no difference in the rate of death or MI in those who had angiographically documented graft failure versus those who had patent grafts. So interesting insights, I think, in understanding what does it actually mean to have graft failure. Not surprisingly, need for more revascularization, but not necessarily clinical events. At the number 2 spot is a paper published this month in JACC Intervention from the Michigan Registry that looks at the use of N-acetylcysteine. This is something that's been used to try and prevent contrast-induced nephropathy. And recent trials in modest number of patients have suggested that it actually doesn't work as we had thought. So this was an analysis of 90,000 patients undergoing angiography or intervention, where about 10,000 received N-acetylcysteine. And when doing multivariate adjustment, they found no difference in any outcomes, be it nephropathy or death and other clinical outcomes, in those who did versus didn't get N-acetylcysteine. And so this is a growing number of studies, this one observational but very large, saying that maybe this doesn't live up to its promise, and something that has crept into clinical care that maybe we need to pull out of routine care. And at this week's number 1 spot is a very interesting study in JAMA called the BRIDGE trial that looked at the use of an intravenous P2Y12 inhibitor, a short-acting one, Cangrelor, as a bridge to surgery. So it was a 200-patient study where patients were had been treated with thienopyridine and thus would normally have to wait a long period of time to let that wear off before bypass surgery, and were randomized to bridging with the IV P2Y12 inhibitor or not. They found during this study that the Cangrelor was able to maintain a high level of inhibition, and interestingly, no difference in major bleeding during that period where the level of inhibition was maintained. And so overall, very favorable outcomes without any difference in CABG bleeding in those who were bridged and thus had the high level of platelet inhibition all the way through surgery. So this is a modest-sized trial showing the feasibility of it, but and one that's not FDA approved, but could open the door to having a means of continuing high-level platelet inhibition through coronary bypass surgery. So for this week's Cardiology Countdown, I'm Chris Cannon.